So we cannot do much for this case. We cannot do much for this patient. Jesus, another senior man has come over with the same deformity, and those passes are very difficult. Passes are very difficult. Faces are very difficult. You can identify this. The face very nicely, even without seeing the whole profile. Was another reason. What is the diagnosis? What is the diagnosis? Yes. So the passes will be very difficult. Limb will be very difficult. Short chubbiness will be there. Chest will be having difficulty in expansion over a period of years. Okay. So for him, he will be having just a reassurance. Actually, the pelvis will be tilted backwards. This boy is 13 years old. Gentleman is 43 years old. A gap of 30 years. This is relatively skeletally immature age. The 13 years is still having some amount of growth in a normal individual. For him, the growth is complete. Almost 30 years, a generation gap is less than 30 years. So 30 years of difference doesn't make any difference in the height. And both of them having short, chubby limbs. The passes and the face are typically similar, and both are having barrenness. As they grow older, as the weight gains, they will be having a backward tilt of the pelvis. Okay. As they walk, you can typically see on side. Can you see that? And he is having breathless. For a small straw, he is having breathless. Which one? Which one? For a very short straw, he is having breathlessness. The point is, his chest expansion will be less as they grow older. And 30 years of difference doesn't make any difference in the height, doesn't make much difference in the the passes and the entire muscular appearance other than the secondary sexual characters. They are having a normal secondary sexual characters. All other things are normal other than the growth. Okay? This is a classical phenomenon that every one of you will be seeing such person. The point is, we have to reassure them, we have to help them in a way that they sustain their life in a trouble-free manner. And all the things that we addressed beforehand itself by telling them, you have to expect these things. These are the remedial measures that you have to take. These are the exercises we have to do for the breathing and the chest expansion. And all other things we have to advise. And the gain of weight has to be strictly controlled. You have to tell them that the weight gain will be detrimental to your general well-being and the mobility. He is having breathlessness after taking a small 10 to 15 steps. So that is the thing that we have to learn from this. Exhale. As I walk, do you see any tilt in my shoulder? Any tilt in my shoulder? Body swaying. I'm turning up and walking. Is there any swaying? Any dip in the shoulder or any tilt? None. What do you see? Right side she is swaying. Yes. Okay. The car What is general purpose? What you saw was general bulk gauge. What is that? General bulk gauge. Patient is swaying towards the side, one side. So which side it is? அப்படியா general bulk side வந்து normal side தான். சரி இன்னொரு திரும்பி வா ரைட் சைடு வச்சு எப்படி ரைட் சைடு வச்சு இல்லையா அந்த ரைட் ஒவ்வொரு லிங்க் வைக்கிற ஒவ்வொரு தடவை வைக்கிறப்பையும் எந்த கால் வைக்கிறப்ப சுய ஆரம்பிக்கும் whenever she plants her right side she sways அப்படியா abductor mechanism. If I stand with one leg, naturally my one half of the body is unsupported. So naturally what should happen? It should tilt towards the side because it has to drop, isn't it? But this is not happening. What is holding that? Is being held by the opposite side of the car that is lifting my pelvis. That is tightening my pelvis. The person is going to stand on a normal side. What will happen? Normal side abductor will maintain the power so that the pelvis will be straight. There won't be any issues. The patient is going to stand on the affected side. Then the knee. What will happen? The affected side abductor fails. so that the patient's pelvis droops. Which side drops lower? Normal side drops lower. The unsupported normal side drops lower. Are you able to follow? In a person, when we lift our limb, the same side abductor maintains the pelvis stance. That means the pelvis will be straight because of the abductor of the weight bearing limb. If the person is having an affected limb and weight bearing is happening on that particular limb, the abductor mechanism fails so that the pelvis drops towards which side? Normal side. Normal side. So to compensate it, what you will be doing? You will be tilting your body towards the midline. I mean, you will be tilting the body. Is that so? Away towards. When they plan their affected side, the pelvis is going to drop. That means it is going to drop on the opposite side. It is going to drop on the opposite side. The entire torso will be tilting towards that particular side. To balance it, what you should do? You move towards the affected side. The limb which is weight bearing. This is lifting my pelvis using my body as a limb. You are able to follow? If I am standing on my normal side, my pelvis is straight, nothing happens. If I stand on an affected side, the normal pelvis sags. Once it sags, my body will also sag along with that. So I have to move forward. What I should do? I have to move the center of gravity towards midline again. That means in which way I am swaying? To the weight bearing side, which may be the affected side. So as I move forward, again it becomes straight. As this is happening, I will be lifting my entire torso and then move forward. This is normal. And this is abnormal, this is going to sag. I'm just going to opposite it by swaying towards the side. If I am going to sway towards this side, it is already sagging, what will happen? Let me just repeat. So this is a typical pendulum gauge where the patient's affected side, when it's weight bears, there will be a tilt of the upper limb towards the weight bearing same side to offload the gravity. So that's why they walk like this. They walk. Okay, fine. The diagnosis, what's the diagnosis? It's an arthritic hip. Arthritic hip means the head is gone and the acetabulum is gone. On both sides they are having erosive changes. And this is typically arthritic. Arthritic is an affected hip. That will be having an altered abductor mechanism. So here, this case is having a bilateral arthritic. And one side is worse than the other side. So comparative terms, the worse side will be paining more. That's why the terminal bug is happening in this. Okay, so this case is here so that we can understand and see about ventral bug gait and why it is happening. Okay, fine. Change it. Screen close பண்ணடா. Close பண்ண மாட்டேங்குது.